glands which are situated on the top of the kidneys, okay? They're known as adrenal glands. Now these adrenal glands, they're made of two portions. One is adrenal cortex and the other one is adrenal medulla. So they're made of two layers, outer layer and inner layer. Outer layer, which is known as adrenal cortex, which synthesizes corticosteroids. Now, corticosteroids, one of the most important corticosteroids is cortisol, androgens, and aldosterone, which we'll see this later on, okay, together. Adrenal medulla produces catecholamines, that is adrenaline and noradrenaline, the other name epinephrine and norepinephrine. Okay. Now, first I'm going to check the adrenal cortex. Adrenal cortex is made of three zones. I don't want you to name the zones, okay? You can know the names. Zona glomerulosa, zona fasciculata, and zona reticularis. Now each of them produce, for example, mineralocorticoids, that is aldosterone, is produced by zona glomerulosa. Corticosteroids, that is cortisol, is synthesized by zona fasciculata. Androgens are synthesized by two zones, that is reticularis and fasciculata. I don't want you to do this, okay? Just this for your own information. Okay. Now the important thing about the glucocorticoids or cortisol is that all of them are synthesized from cholesterol. So cholesterol is the precursor for synthesis of cortisol and also androgens. Very important, okay? It is very important for synthesis of cortisol or corticosteroids and also androgens. What do we need? We need cholesterol. So cholesterol is the precursor for their synthesis. As you can see, cholesterol is converted into pregnenolone, progesterone. We've got synthesis of cortisol, mineralocorticoids. We discuss this later on. We'll see together the aldosterone. Okay. Now this is the pathway for the synthesis. I presume that you have already studied this. Have you studied the pathway?
Yes.
Yes, before you study. Okay, I don't want you to learn the pathway, okay? But as you can see, the precursor for the synthesis cholesterol. Cholesterol comes, you've got the synthesis of corticosteroid, cortisol, aldosterone. We go for synthesis of cortisol and also androgens. Remember, androgens are the precursor for synthesis of testosterone. Okay, androgens are the precursor for synthesis of testosterone. Okay, now. If I want to discuss about the storage, we don't have the storage of these hormones as such. These hormones are synthesized, they're released in the bloodstream, and the synthesis of cortisol, okay, depends, it's a very rhythmic, you can say it's depends upon the time of the day, okay. It got many fluctuations during its production, okay. It's under the influence is production of cortisol is under the influence of ACTH. ACTH affects the production of cortisol, but how it is produced, you have to remember, one of the things that sleeping is very important for our body, okay? When you go to sleep, okay, 1 or 2 hours after sleeping, what happens? The level of ACTH starts rising, okay? So 1 or 2 hours after sleeping, the level of ACTH rises. So what happens? Then we have the increase in the amount of cortisol. So cortisol also rises. When you wake up in the morning, okay, for example at 8 o'clock in the morning or 7 o'clock when you wake up in the morning, what happens? The level of ACTH as well as cortisol is in its highest amount, okay? That is the reason that when you wake up in the morning you feel very fresh, because the amount of cortisol is in its highest level. But during the day, as the day goes by, gradually the level of cortisol is decreased in the blood. That is the reason that in the evenings you feel tired, exhausted, because the level of cortisol has decreased, okay? And remember, if you do not sleep, say for 1 or 2 nights, then what happens? there won't be enough cortisol in your blood. What will happen? You will feel depressed, you feel tired, okay? And so it's very important. For example, during the examination, when you do not sleep for 2 or 3 days, you feel very restless and you feel bad. You know, it's something, you don't feel good, I can say in a way. So sleeping is very important for the production of cortisol in the body, okay? Okay.
Doctor, what's the full name of ACTH?
Sorry.
Full name of ACTH?
Adrenocorticotropic hormone. Adrenocorticotropic hormone. We'll see this later, okay? Adrenocorticotropic hormone. Okay, let's see how they're transported. Now, for example, cortisol binds to CBG, corticosteroid binding globulin. It is also known as transportin, CBG, and it moves in the blood, okay? Also progesterone and deoxycorticosterone, also they can bind to CBG. But remember, in case of aldosterone does not have a specific transporter. They say maybe it binds to albumin and it can travel in the blood with the help of albumin. Okay, let's see how they are excreted from the body, which is very important, okay? Now, in case of glucocorticoids, that is cortisol, first it is hydrogenated, okay? So, first it is reduced or hydrogenated. Then it is conjugated with either glucuronate or sulfate. So, first hydrogenation, reduction, okay? Then conjugation with sulfate or glucuronate. Then it is excreted from the body. Okay, so this is in the case of cortisol or glucocorticoids. Next, in case of mineralocorticoids, which is aldosterone, mineralocorticoids or aldosterone. Okay, again, reduce it, hydrogenate it. So first hydrogenation, then conjugation only with glucuronate. Okay, so conjugation with glucuronate, excreted from the body, from the blood. Understood?
By what?
So,
Conjugation?
Conjugate only with glucuronate.
Cortisol?
No. Cortisol, first hydrogenation, that is reduction, then conjugation with either glucuronate or sulfate.
Okay.
Then excretion from the body. Okay? In case of aldosterone, first hydrogenated, that is reduction, then conjugation. Conjugation with what? Only glucuronate. Then it is excreted from the body. Now, in case of androgens, very important. Androgens are excreted from the body in the form of 17 ketosteroids. Very, very important. Androgens are excreted from the body in the form of 17 ketosteroids. That is androsterone and ethiocholanolone. Very important, okay? So, if I ask you how androgens are excreted from the body, you will say in the form of 17 ketosteroids. What are 17 ketosteroids? Androsterone, ethiocholanolone. Androsterone, ethiocholanolone. Okay? So very important. So, cortisol, hydrogenated, conjugated with glucuronate sulfate, excretion. Okay? Aldosterone, hydrogenated, conjugated with glucuronate, excreted from the body. Androgens, it is excreted in the form of 17 ketosteroids, that is androsterone, ethiocholanolone. Androsterone, ethiocholanolone. Okay. Next is, let's see what are the functions of cortisol or corticosteroids. Function of cortisol or corticosteroids. Remember, first we study about carbohydrates. Remember, cortisol increases the blood sugar. Okay? Cortisol increases the blood sugar. Okay, first, it increases gluconeogenesis. What is gluconeogenesis? Synthesis of glucose from non-carbohydrate molecules. Okay? So increasing the gluconeogenesis, glucose is raised. Okay? Okay. Now, when the level of sugar is raised in the body, you need something to produce energy for you. Okay? Okay, come on. Break down amino acids. Okay? Now, glycogen is stored. We don't have anything to do with glucose. And also, we do not let cells take glucose. Okay? So what happens? The level of sugar is raised. Okay? Okay. Now, let's go to the lipid metabolism. You are not using glucose, so use the lipids. Break down the lipids, okay? Lipolysis. Okay. Now, increase in the amount of fatty acids which is there in the blood circulation, and fatty acids are used, okay? Fatty acids are used for TG synthesis, but I don't want the fatty acids to be used because I want to oxidize them and use it as energy, okay? So there's a decrease in the synthesis of TG. So TG synthesis is decreased. Is it clear?
Yes.
So what I'm going to do is, I'm going to raise the blood sugar. I'm going to use amino acids, I'm going to use lipids. So lipolysis, understood? Lipolysis, break down the lipids, use amino acids, and increase the level of sugar by gluconeogenesis. Very, very important, okay? So if I ask you, what is the effect of glucocorticoids, you will say increasing the amount of gluconeogenesis, okay, to raise the level of sugar.
When someone he have allergy, then he used cortisone.
We'll say, I'll tell you why. I'll tell you.
Okay.
The thing is that one of the effects that cortisol does is it suppresses the immune system. Okay. Now, allergic reactions is what is the reason? Too much immune reactions in the body. So, what does cortisol do? It suppresses the immune reactions.
My question is why he gets some weight and the cortisol is lipolysis, it makes lipolysis. So he must lose weight. When someone took cortisol, he gains some weight.
Yeah, because what does cortisol do? Cortisol, one of its effects is it increases, okay, the fat deposition, okay, on face and also on the trunk, this part of the body. Fat deposition, okay? Arms become thin. Just wait till you reach. Okay, I'll tell you. Okay, wait. Okay. Okay, let's see what is this effect on protein metabolism. I want to use amino acids, okay? What should I do? Break down the proteins, okay? So in extrahepatic tissue, okay, extrahepatic means not in the liver, okay, in other organs. Okay, break down the proteins. But in the liver, in hepatic tissue, synthesize proteins, okay? So protein synthesis in the liver, but in extrahepatic tissues, we've got degradation of proteins. Okay, we have got promotes the transcription of some specific genes in the liver, forget it, okay? Now, one of the most important effects of, we can say, glucocorticoids is it decreases the amount of ADH. That means it inhibits the effect of ADH, anti-diuretic hormone, okay? So it has got a negative effect on ADH, okay? It has got a negative effect, it inhibits the effect of ADH. Okay, now in case of immune system, it suppresses the immune system. Okay, it suppresses the immune system. One of the uses of we can say cortisol, okay, in medicine is for suppressing the immune system. For example, you've got throat, okay, throat ache. Okay, you cannot swallow, okay, for too much cough. What is the reason for it? Because the immune system, it helps, okay, for you to have worse throat sore, okay? That is one of the reasons that you feel you swallow anything, you've got too much pain in your throat. So what they do is they use injections of cortisone injections. Cortisone is actually cortisol. So they give cortisol, they suppress the immune system. You feel better. You can drink, you can swallow. It makes you feel much better. Okay? Okay, next. Okay. So let's go to hypothalamus. We've got synthesis of CRH or corticotropin releasing hormone. It causes synthesis of ACTH or adrenocorticotropic hormone. Okay, ACTH goes and then in the bloodstream it reaches different cells, and you will see this effect what we discussed before. We said that the blood sugar has to, it increases the level of blood sugar. It has got the effect, positive effect on gluconeogenesis, which is very, very important. What about the lipids? Lipolysis. Gluconeogenesis is increased, okay? Lipolysis is increased, that means breakdown of fatty acids, which is very, very important. Okay. Let's see what are the effects of androgens, okay? Now, androgens, they can be in the form of dehydroepiandrosterone and androstenedione, okay? These are the precursors for synthesis of testosterone, very important. So androgens go for synthesis of testosterone. Now, let's see what are its effects. General effects: growth, development, maintenance of male reproductive organs, okay? Okay, if a person wants to grow, they need proteins, okay? Okay, so we have proteins are synthesized in the body, and there is positive nitrogen balance. This is nitrogen balance. See, when someone is growing, okay, someone is growing, for example, a baby who's growing, okay, to become an adult, there is a positive nitrogen balance. That means all the amino acids are consumed. Okay, all the amino acids are consumed. Nitrogens are not excreted from the body as such. So it's positive nitrogen balance. But when a person becomes an adult, there is a balance, okay? There is a balance. When a person becomes old, what happens? There's a negative nitrogen balance. What does it mean? The person starts losing protein, okay? That is the reason that when you see an old person, the old person, okay, all the body, okay, you can see the muscles are deteriorated, okay? So it is a negative nitrogen balance. So what does this cause? Androgens cause a positive nitrogen balance, okay? Okay, now, you want to synthesize protein, you want to grow, you need energy. Okay, where does energy come from? Glycolysis. Okay, so break down the sugar, break down the fats, okay? Tricarboxylic acid cycle is activated to produce energy for you. So energy is produced. Okay, if you want to grow, your bones should grow. Do you need minerals?
Yes.
Yes, I need minerals, okay? So where minerals are, there's an increase in their absorption, also in their deposition in the bones, okay, for bone growth. Okay. Let's go to mineralocorticoids or aldosterone. Aldosterone, okay, one of the things it does, its effect is, it increases, okay, in the absorption of sodium and water. So sodium and water together are absorbed. What is excreted from the body? Potassium, hydrogen, and ammoniac. Okay, I repeat again. With the help of aldosterone, what happens? Sodium and water is reabsorbed. So the amount of water, the amount of sodium is increased in the blood. What is excreted from the blood? From the body? Potassium, hydrogen, and ammonia is excreted from the body. When large amounts of sodium and water is reabsorbed, the blood pressure is raised. Okay, the blood pressure is raised. Okay? That is the reason when you take too much salt, okay, when you take too much salt, what happens? Sodium, you're taking sodium, and with the help of sodium, water is also enters your body, okay? Reabsorption of large amounts of water, so blood pressure rises. Okay, for example, when you take pills to decrease the blood pressure, what happens? Water is excreted from the body. Okay, water goes out, hypovolemia, the blood pressure is decreased. Is it clear? Yes? So, what does aldosterone do? Increasing the amount of
Water
sodium and
absorption.
water in the blood. What is excreted?
Potassium.
Potassium,
hydrogen,
hydrogen, and
Ammonia.
ammonia. Okay, great. Now, let's see how does it do. See, there are some cells in the body, okay, by the name of juxtaglomerular cells. These cells are present in the kidneys, okay? So, when we go to the kidneys, okay,
Glomerular cells.
Cells. These juxtaglomerular cells in the kidneys are very sensitive to changes in the blood pressure. Okay, when the blood pressure is decreased, okay, these cells produce renin. Okay, so these cells, juxtaglomerular cells in the kidneys are very sensitive to changes in blood pressure. So when the blood flow, okay, the blood flow in the kidneys, the blood pressure is decreased, what happens? These cells produce renin. What does renin do? Renin goes and acts on a molecule which is known as angiotensinogen. Angiotensinogen is produced in the liver, very important. So renin is produced in kidneys, angiotensinogen is produced in the liver. Okay, so renin converts angiotensinogen into angiotensinogen 1. Angiotensinogen 1 is converted into angiotensinogen 2. Angiotensinogen 2 acts on the adrenal cortex for production of aldosterone. So aldosterone is produced. What does aldosterone do now? Reabsorbs sodium and water. What is excreted? Potassium, hydrogen, and ammonia. Is it clear? Okay, great. So blood pressure is raised. Okay, is raised. Okay, guys. Next is, let's go to adrenal cortex. Now I'm going inside, okay? In adrenal cortex, we've got synthesis of adrenaline and noradrenaline, or epinephrine and norepinephrine. Remember, the precursor for synthesis of adrenaline and noradrenaline, or epinephrine and norepinephrine, is amino acid tyrosine, very important. Okay, so amino acid tyrosine is the precursor for synthesis of catecholamines. Catecholamines are adrenaline and noradrenaline. Is amino acid tyrosine is converted into dopamine, norepinephrine, and epinephrine. Is it clear?
Yes.
Now, what was the precursor for synthesis of corticosteroids, which we discussed before?
Cholesterol?
Cholesterol. Cholesterol. Remember? Cholesterol was the precursor for synthesis of cortisol and also androgens. Okay. Okay, forget that. Now, see, this hormone, okay, adrenaline and noradrenaline, okay, these are the hormones, okay, which make you prepare, okay, to take proper decision at the proper time, okay? For example, okay, I have an exam, okay? So adrenaline, gradually what happens? Is raised in my blood, okay? Now my brain is ready, okay, to do the test properly, to write the test properly, okay? For example, I'm walking on the street, there is fire. All of a sudden, adrenaline is raised. I start running, okay? That I won't be affected by the fire. Or a car is coming towards me. I have to take the decision. Quickly, I have to move. Is it clear?
Yes.
So, what happens actually? Actually, the level of sugar is raised in my blood. Okay? Level of sugar is raised. The amount of fatty acid is increased. Okay? So there is food for my brain. Large amounts of food is ready for my brain. Okay? My blood pressure is raised. You can feel your heartbeats, you know? The heartbeat goes gradually is increased, okay? So adrenaline is produced. Now one of the things that people do is nowadays is they try to increase the amount of adrenaline in their body, okay? Like, you will see that they tie their legs and they jump from altitude. Yeah? Okay, why? They want to produce large amounts of excitement, okay? For the level of adrenaline to increase, okay? Or for example, have you ever experienced roller coaster?
Yeah.
Roller coaster, it goes up and then all of a sudden it comes down, okay? So what happens? Your heartbeat goes so fast, okay? The amount of adrenaline is raised to a very high amount, okay? So actually what happens? Increase in the heartbeat pressure, the blood pressure is raised, the amount of sugar is raised, fatty acids are raised, so large amounts of food is there for your brain. Is it clear? So this is what adrenaline and noradrenaline do, okay? Okay. glucose levels, blood pressure levels. You must have seen it start breathing fast, okay? The metabolic, we can say pathways or the metabolic rate is raised, okay? So the brain, especially the brain cells, are ready to receive large amounts of food, okay? To be prepared to take, as I said, to take the proper decision and to, and one of the things people do is they like excitement, okay? They like to be excited, okay? Too much of excitement. Okay, so what happens? The level of sugar should be raised, okay? So glycogen is broken down, okay? Glycolysis is activated to produce large amounts of energy. This is tricarboxylic acid cycle, TCA, okay? Is increased for production of ATP, large amounts of, we can say, energy. In case of protein metabolism, proteins are broken down in the form of amino acids for production of energy. Okay, lipid metabolism, lipids are broken down. Glycolysis, fatty acids are released. They go for oxidation to produce energy for the person. Okay. Now, if there is large amounts of activity, this sometimes happens, okay, in case of adrenal medulla, that is the inner portion which produces catecholamines, okay. The cells, they can turn into the cells which is known as pheochromocytoma to produce large amounts of adrenaline and noradrenaline, okay, which is not normal, okay. It can be like tumors over there which produce large amounts of adrenaline and noradrenaline, which is known as pheochromocytoma. Pheochromocytoma, okay? So large amounts of epinephrine and norepinephrine is produced. Okay. Now let's go to disorders of adrenal cortex. We said in adrenal cortex we have synthesis of glucocorticoids, that is cortisol is produced, androgens are produced, and aldosterone. Let's see if large amounts of these are produced or low amounts, what will happen, okay? Remember, hyperfunction of adrenal cortex is known as Addison's disease. So Addison's means hyperfunction, okay? We do not have enough hormone in the body. Is it clear? So the level of cortisol is decreased. Okay, if the level of cortisol is decreased, what happens? The level of sugar is decreased. Okay, so hypoglycemia. Okay, hypoglycemia. The blood pressure is decreased. The blood pressure is decreased. The person feels, tired, sleepy. Okay, he or she doesn't have enough energy. Okay, so now let's go to aldosterone. The level of aldosterone is decreased. The blood pressure is decreased. Sodium is decreased. The water, but the volume of the water in the blood is decreased. So hyponatremia, hypovolemia. Okay. Okay. What is increased in the blood? Potassium. Potassium is increased.
Yes.
Hyperkalemia.
Ammonia.
Okay. Hydrogen is increased. Acidosis. Okay. So remember, hyponatremia, hypovolemia, hyperkalemia, and acidosis. Is it clear?
Yes.
Okay, great. Okay, now Addison's disease, it can be very dangerous. Okay, it can be life-threatening. Okay, it is dangerous. It can be life-threatening. Sometimes you know what happens. Sometimes anything that affects the gland, okay, destroys the gland. Sometimes infections can destroy the gland. Okay, like viruses, bacteria. Sometimes surgery. Sometimes removal of the kidneys. Okay, if the kidney goes, what happens to the gland? The gland also goes, right? Okay. So trauma, like accidents, okay? Anything can cause destruction of the gland. Okay, now let's see if large amounts of hormone is produced, what will happen, okay? Large amounts of hormone is known as Cushing's syndrome. Cushing's, very important, okay? So large amounts of hormone, it is produced, we call it Cushing's syndrome. So Addison was low amounts. Cushing is large amounts, okay? So let's go to Cushing, see what happens. happens when, in case of Cushing syndrome, what happens? Okay. Now, if large amounts of cortisol is produced, okay, let's go to sugar. What happens to sugar? Increase in the amount of sugar, right? Okay. Now, one of the things that happens, okay, in large amounts of fats, okay, is deposited on face, okay, and also over here on the back, this side, okay, and also they call it moon face. The face becomes like a moon. It becomes round, okay, moon face, and also large amount of deposition of fats over here, okay, on the back side. They call it buffalo hump. You know, say buffalo. Buffalo is a cow. Okay, buffalo is a cow. Over, if you see that buffalo over here on his back, it comes up. Okay, so they call it buffalo hump. Okay, so moon face, buffalo hump, the trunk. This part of the body becomes fat. Okay, this part of the body becomes fat. Face also, like a moon. Arms, okay, and the legs become very thin. Okay, the legs and arms become thin. Okay, the level of sugar is raised. Okay, tell me about sodium. Sodium increase. So hypernatremia. What about water?
Decreases.
Hypervolemia. Okay, potassium.
Decrease.
Okay,
Hyponatremia.
Hypokalemia. Okay, what about hydrogen?
Decreasing. Alkalosis.
Alkalosis. Okay, great. Now,
What about ammonia? Does it also decrease?
ammonia, yes, is decreased. Okay, tell me something. What happens to blood pressure?
Increase.
The blood pressure is also increased. Is that clear?
Yes.
Okay. Now, one of the things in case of large, high amounts of cortisol is, you know, the skin becomes very thin, okay? And there are stretch marks, you know, like marks, red marks, okay, comes usually on the arms, on the stomach, okay, on the thighs, okay? Because of the increasing the amount of cortisol, the skin becomes very thin. Okay, we said that, what does cortisol do? We said cortisol, affects the immune system. You remember we discussed this before? It suppresses the immune system. So what happens when large amounts of cortisol is there? The immune system becomes very suppressed, too suppressed, okay? And it's not good for the body. Okay, it's not at all good for the patient, okay, for the body. Okay. Now, if there's large amounts of androgen is the male sex hormone. What happens? Androgens go for synthesis of testosterone, okay? So in females, it's not very good, okay, to have large amounts of testosterone in the body. Now, this can give rise to hirsutism. You know what this hirsutism is? Growth of hair in the places where it should not grow. For example, in case of a female, okay, I shouldn't have beard over here, okay, over here. It's not normal, okay? So, what happens in case of large amounts of testosterone in female body, okay? The voice can become like a man, you know, it becomes like hoarse, growth of hair, and the places where it shouldn't grow over here, beard grows, okay? So it's known as hirsutism. So hirsutism is also seen. Also, sometimes it can affect the ovaries, okay? So it can affect the menses, that means the monthly period of females, okay? Which is known as oligomenorrhea, okay? Oligomenorrhea can affect it. Okay, let's go to hyperaldosteronism. Okay, we know what are the symptoms now, right? In hyperaldosteronism, what happens? Raised sodium, water, decreased potassium, decrease in the amount of hydrogen. Okay. Now there are two types of hyperaldosteronism, very important, okay? In case of primary hyperaldosteronism, okay? Sit. Okay, in case of primary hyperaldosteronism or Conn's syndrome, okay. Sometimes there's a tumor, okay, in the body. This tumor, not necessarily in the adrenal gland. It can be anywhere in the body. Okay? It produces aldosterone. Okay? It produces large amounts of aldosterone. Do you need renin-angiotensin system?
No.
No. Aldosterone is directly produced. Okay? So, in Conn syndrome or primary hyperaldosteronism, what happens? Hormone, aldosterone is produced directly from cells, okay, tumor cells, which are there in the body. So we do not need renin-angiotensin system. So renin-angiotensin system is switched off. Okay, so in primary hyperaldosteronism, renin-angiotensin system is switched off. Is it clear? Because there are cells which they produce aldosterone directly.
Would this cause the gland to shrink?
Not necessarily. Not necessarily. There's a tumor in the body somewhere. The adrenal gland is functioning for itself. The tumor is producing, because there are some tumors, okay, in the body that they can produce hormones. Okay. Okay. Now, in secondary hyperaldosteronism, see, this is the kidney. Okay. There are arteries. Okay. There's blood flow to the kidney. Sometimes what happens, for example, you are dehydrated. What happens? The blood flow is decreased. So what happens? Renin is reduced. Sometimes there is bleeding. Okay? The volume of blood is decreased. So blood flow is decreased. So renin is produced. Sometimes there is stenosis. See here. The veins, you know what, they shrink. They get small. So blood flow is decreased. Okay? Blood flow is decreased. So what happens? Renin is produced. So in secondary hyperaldosteronism, okay, many things. For example, low blood pressure, dehydration, bleeding, stenosis, any one of them can cause an increase in the amount of production of renin. And what happens? The renin-angiotensin system is on. Okay? So in secondary hyperaldosteronism, renin-angiotensin system is switched on. Is it clear? So, in primary hyperaldosteronism or Conn syndrome,
Adenoma.
Renin-angiotensin system is switched
Directly.
off. But in case of secondary hyperaldosteronism,
Switched on.
The renin-angiotensin system is on. Very, very, very important. Is it clear? So you understood the difference?
Yes.
Yes, okay, great. Okay, so this is what we discussed together before. Okay, phochromocytoma, if you remember, we said that, for example, in case
Cancer
of
in the
adrenal
adrenal.
cortex, the cells, they can be a production of tumor, which is known as phochromocytoma. What will happen? Tell me.
Increased
The blood pressure
KTO.
is
Increased.
The blood pressure is
Increased.
increased. Sugar is increased. Fatty acids are increased. Okay, fine. Okay, now, this is a person who's having Cushing's syndrome. See here. See. If you compare, okay, her trunk, okay, with her arms and legs, it's very, if you see, the trunk is so big, okay, but if you compare it with her legs, okay, the legs are very thin, okay. So when a person, okay, for example, is fat, okay, a person is fat, and the level of sugar is high in the blood, okay, that means it is hyperglycemia, okay, the sugar is too high in the blood. When that patient, okay, goes to the, for example, endocrinologist, okay, and she or he checks the blood sugar and says, yeah, the level of sugar is too high, you're suffering from diabetes, okay, but maybe the person is suffering from Cushing syndrome. So it's very important that when a fat person goes to the physician, because physician cannot tell the person to take off your clothes, okay? So when whoever goes to the physician, they go with their clothes on. So they don't see the legs or arms, okay? So what they do is, they always have to check for cortisol level. There is a test, okay, specific test they check. whether the amount of cortisol is normal in the blood or it is abnormal. Understood? If the cortisol level is normal in the blood, then the patient is suffering from diabetes. Okay? Otherwise, if the cortisol level is not normal, the patient should definitely be checked again. This double check, they check it again for Cushing syndrome. There's another test, which is the completion of the first test, okay? They check it, and if the patient is suffering from Cushing syndrome, he or she should go under medication and check exactly what is the reason for high levels of cortisol in the blood. Is
So,
it clear?
high cortisol levels mean Cushing disease?
Yes, high cortisol level is Cushing disease. And one thing that you should remember is, we said that cortisol has got a negative effect on ADH. Remember, antidiuretic hormone? But very important point is it has got a positive effect on PTH. Okay, so cortisol has got a positive effect on PTH. You know what is PTH?
Parathyroid.
Parathormone. Parathormone, what does parathormone do? Parathormone
Releases
removes
calcium.
the calcium from the bones and brings it to the blood. Okay? So, if I take too much of cortisol, okay? Now, for example, some people, they have pain. They get a shot, okay? For example, for cortisol. If too much shots of cortisol, or if I'm taking too much pills of cortisol, what will happen? PTH is activated. Then what happens? All the calcium from bones are removed. The bones become brittle. They can break. Okay? The bones can break. So one of the things that if a patient is undergoing cortisol therapy, okay, cortisol therapy, they should definitely be medicated for increasing somehow the amount of calcium in the bones, for example, with the help of calcitonin. Okay, calcitonin acts opposite of PTH, okay? So it takes all the calcium into the bones. Is it clear? So it should be done together. Okay, guys, finish. Okay, yeah.
So, doctor, when you take cortisol, you also have to take calcitonin?
Yes, together. Do you have any questions?